When you cross into your 60s, something shifts in the exam room. The appointments feel shorter, the eye contact less frequent. The doctor glances at the computer more than at you. Sometimes your words are interrupted, or you hear, "That's normal for your age." I've spoken with countless older adults, and I've felt it myself. It's not usually cruelty. Most doctors are under heavy pressure. But the system encourages shortcuts, and age becomes one of them. Today, I want to share 5 truths about medical ageism. Some are difficult to hear, but each comes with a way to respond. Knowledge really does change the story. When you see the pattern, you can interrupt it and turn yourself from a passive patient into a partner in your care. Before we dive in, if you find comfort in honest conversations like this, hit subscribe. We share stories that don't just pass time, they help make sense of it. The complex label. The first truth is that once your age is written on the chart, a mental calculation sometimes happens. This patient will take longer, need more tests, cost more to treat. Maxine, a retired librarian, brought careful notes to her appointment. Before she finished her first sentence, the doctor cut her off. Let's just focus on the main issue. Her chest pain was dismissed as anxiety. 6 months later, it was diagnosed as a heart condition. This isn't usually malice. It's the system, packed schedules, insurance quotas. Seniors are often placed in the too complicated box before the exam begins. I remember once handing over my own list of concerns, only to see the doctor sigh and glance at the clock. A small gesture, but the message was clear. Too much, too messy, too slow. How you push back? Set a clear goal. Instead of "I'm tired," say, "My energy has dropped 40% over 3 months, and I want to know why." Bring a 1-page health snapshot. Show your main issues, improvements, and medications. Negotiate time. If today's slot is short, ask for a longer follow-up focused on one concern. It reframes you from being a complicated case to being a collaborative partner. And often, once doctors realize you're organized and intentional, they engage more fully. "That's just aging" brush off. The second truth is polite dismissal. You bring up something new, and the response is, "Well, that happens as we get older." Carl, a retired construction supervisor, endured this. For nearly a year, he reported stiffness and fatigue. Each time, "You're not 30 anymore." By the time tests were run, rheumatoid arthritis had caused permanent damage. This age filter delays real diagnoses. Heart disease looks like fatigue. Depression looks like adjusting to retirement. Even cancer gets written off as wear and tear. The sting isn't just the delay, it's the erosion of trust. I've heard friends whisper, "I don't even bring up small changes anymore. They'll just tell me it's age." That silence can be dangerous. I once knew a man who delayed reporting chest pain because he assumed it would be dismissed. He ended up in the ER a month later. How you push back. Be precise. Track symptoms with dates. Since March 15th, I've needed daily naps. Ask the comparison question. If I were 40, what tests would you order? Bring someone with you. A spouse, friend, or adult child can ask follow-ups and signal accountability. Age should provide context, not an excuse. When you bring evidence and allies into the room, dismissal becomes much harder. The silent assumption about your mind. The third truth is the belief that older adults can't process complex information. Doctors simplify explanations, skip details, or withhold advanced options. Louise, a retired chemistry professor, faced this with breast cancer. She was offered the simplest surgery with no mention of reconstruction or targeted therapies. Only when she pressed did she learn about alternatives. I've seen it too. Slowed speech, dumbed down language, fewer details. And after enough of these experiences, some seniors begin to doubt themselves, believing they really can't keep up. That's not just unfair, it's harmful. I think of a neighbour who once told me, "I just nod along now. I don't want to look confused." That's what unchecked assumptions can do. Silence a patient who actually has plenty of capacity. How you push back. State your capacity. I managed complex projects for decades. Please walk me through the options in detail. Ask for the medical why. How does each treatment address the cause of my condition? Use technology openly. Check labs or meds on your phone. It silently says, "I can handle this." What matters is not your age, but your ability to understand and decide. Remind them you want to be an informed partner, not a passive recipient. Medications for convenience, not healing. Sometimes drugs are prescribed not to treat conditions, but to make patients easier to manage. Beverly, a retired principal, experienced this after hip surgery. Frustrated with her slow recovery, she pressed for details. Soon she was labeled anxious and given medication. The side effects, confusion and imbalance, caused a fall that broke her wrist. Her recovery dragged on months longer. It happens more often than we think. Sleep aids for normal aging, sedatives when patients ask too many questions, pain meds withheld because seniors are assumed to exaggerate. I've seen friends prescribed just-in-case pills that no one could quite explain. And too often, the side effects create new problems that are then chalked up to just aging. How you push back. Ask what condition it treats. If it's for nerves, ask for the diagnosis. Request measurable outcomes. How will we know this drug is working, and when do we stop it? Seek a medication review. Pharmacists and geriatric specialists often spot unnecessary prescriptions. Record your baseline, mood, balance, memory, so changes can be tracked to the drug, not your age. Medication should restore your life, not control it. And if a prescription makes you feel worse, that's not normal. It's a signal to question it. The value calculation. The last truth is the hardest. Sometimes treatment decisions weigh expected years of life, not just medical facts. Economists call it quality-adjusted life years. Walter, a retired engineer with kidney failure, was told dialysis might not be worth it. He fought back, got the treatment, and lived 7 more active years. Behind closed doors, seniors are sometimes denied expensive imaging or therapies, not because they wouldn't help, but because of actuarial math. Families often hear it softened as, "It may not be worth putting them through this." Those words can echo painfully. I once sat with a friend whose mother was discouraged from surgery after a fall. The doctor said gently, "At her age, recovery may not be worth it." But she chose the surgery, and within 6 months she was walking again, spending another 3 years gardening and laughing with her grandchildren. Imagine if she'd accepted the first suggestion. How you push back. Ask the 40-year-old test. Would this be recommended if I were 45? If not, why? Bring outcome data. Many seniors respond well. Remind providers of that evidence. Get second opinions. Geriatric specialists tend to value longevity and function at any age. Seek legal advocacy if needed. Age discrimination in healthcare is against the law. Your life doesn't depreciate like a used car. It holds full value until the very last breath. I know this all sounds heavy, but knowledge changes everything. Think of Walter, who fought for dialysis. Think of Beverly, who questioned her medications. They aren't exceptions. They're proof that advocacy works. I've seen quieter victories too. A neighbor who tracked symptoms and caught cancer early. A friend who sought a geriatric opinion and found treatments her first doctor never mentioned. A widower who brought his daughter to visits and finally felt respected. One woman in my church simply said, "Doctor, treat me as a partner, not a passenger." Her care shifted immediately. And maybe you've had moments too, small but powerful, where you asked a second question or requested one more test, and the answer changed your health journey. These moments remind us that while the system isn't perfect, our voices still matter deeply. Your age should never reduce the care you receive. You carry wisdom, resilience, and history. Those things should add to the respect you're given, not subtract from it. So here's my invitation. At your next appointment, try one strategy. Ask one clarifying question. Bring one page of notes, or simply say, "Doctor, I want to be a partner in my care." Small actions build big changes. If you've felt dismissed in a medical setting, you are not alone. Share your experience in the comments. Your story might give someone else the courage to speak up. Subscribe if you haven't already, because together we're rewriting the story of aging in healthcare. Not with bitterness, but with strength, clarity, and dignity. One appointment at a time.